So what exactly is informed consent? If you've ever been to therapy or a doctor's office, you've signed one of these. It's pretty much what it says. You have been informed of what you can expect from treatment, your right to privacy, and confidentiality. Formally, it is the process by which the treating healthcare provider discloses appropriate information to a competent patient so that the patient may make a voluntary choice to accept or refuse treatment. The purpose of this video segment is to do exactly that. Give the appropriate information to you, the competent recipient, so that you can make a voluntary choice to participate or not. So with that objective in mind, let me clearly state that PVC is designed for non-mental health disorders. What this means is that by choosing to participate, you are declaring that you are not seeking help for a mental health disorder. Okay, so the obvious question might be, how do I know that? Good question. Mental health disorders are described, categorized, and outlined in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. This is the Bible of mental health descriptors, published by the American Psychiatric Association. It is the manual that all mental health professionals use to diagnose, categorize, and share mental health information with other mental health professionals. It is not a top secret manual. In fact, there are multiple sites on the internet to download copies of it for free. It's written in plain English and does not contain too much medical jargon that would make it unintelligible for the average person to read and understand. The DSM is what we all use to diagnose. Of course, we licensed professionals like to think that our years of training make us more qualified to use it. But with the kind of information that has been shared with me by many of my clients over the years, sometimes I seriously have to wonder. I have had many clients state rather matter-of-factly that they have bipolar disorder. But after multiple interviews, they are clearly no more bipolar than I am. That sort of thing makes my skin crawl. But that's another story for a different day. So if you have any doubt as to whether or not you have a mental health disorder, that just might be a good place to start. If you feel you might meet the criteria, then by all means seek help from a professional in person. Another source might be WebMD. Now, I'm not saying that you should try and diagnose yourself. What I am saying is this. If you think you do have a mental health disorder, PVC is simply not for you. It's just that simple. And when you sign the consent to participate in PVC, you are indicating just that. And if through the course of conversations with you, I start to wonder if you do, I will inform you of that and you can come in for an assessment, or I would be happy to refer you elsewhere. With PVC, there will not be an assessment of any kind or any kind of diagnostic evaluation. If you want an assessment, you can certainly schedule one face-to-face in my office if you want. Or again, I can refer you to an agency that will be glad to help you. If you prefer online treatment, Talkspace.com is a place that I might refer you to as well. With PVC, I do not assess, diagnose, or treat mental health disorders of any kind, period. Your signature to the informed consent will indicate that you understand and voluntarily accept this. PVC is restricted not only to non-mental health disorders, but also to a very selected scope of problems. At this time, there are about 7 topical areas to select from. These are featured in my proprietary therapeutic videos found on the video tab on my website. weight loss, responsible drinking, stress and anxiety management, managing to exercise, performance anxiety, food addictions, and managing your sleep. In addition to these specific topics, PVC includes ancillary, general topical areas such as gaining more confidence, motivation, self-discipline, commitment, optimism, or mitigating worry, self-doubt, getting overwhelmed, or overthinking things, or playing out worst-case scenarios. This is not an exhaustive list by any means, but you get the gist. These are not mental health disorders. Now, of course, I will be adding new video series continuously based on demand. So if you don't see what you're looking for, please contact me anyway and let me know what you would like to see. I welcome feedback from you to help prioritize the order in which I will create new premium video series. I may just use your topic and invite you to participate in a case study to help me develop that series. Something you should know about diagnostic impressions is that an accurate diagnosis should be accompanied by what we call a Gaffe score, G-A-F, which is a global assessment of functioning score. This is included in the DSM manual, and it's used to determine just how well someone is able to function. It's a common practice to include this score in a diagnosis. In my book, it's a very important factor. You will find a copy of this GAF or Gaffe Scale in the margin on this page. Please take the time to look at it. In my professional opinion, if you score higher than a 70 on this scale, you are unlikely to have a mental health disorder. In my opinion, this is probably the first place to start when deciding whether a diagnosis even exists. And here's the reality check. 75% or more of my clients will score well over 70 on this scale. Now, having said all of that, hear me clearly. If in doubt at all, go see a professional in person. Another major component of this informed consent concerns personal health information. By signing this consent, you declare that you have been informed that as a practitioner of PVC, I do not need or want your personal health information, period. And since I won't have it, I won't have to protect it. A big part of keeping the cost of PVC low is to minimize administration, paperwork, and layers upon layers of security. These things are quite costly. So, by agreement, whatever you send me or tell me is information that you personally waive the right to protect. Of course, I will protect it. I will protect any text or any email or anything you tell me to the best of my ability, just as I do within the walls of my office. You're simply waiving the right to legally pursue should some sort of virtual communication, an email, voicemail, text message, or voice message inadvertently reach the wrong destination. And then there is confidentiality. Anything you say, type, or text will be kept confidential and never shared with anybody. That's no different than if you were in my office. However, I cannot guarantee that phone or internet transmissions are 100% secure. Transmissions will be conducted over the normal channels of cell phone and internet. There are added layers of encryption, but keep in mind that the FCC already does a pretty good job of protecting this information. The government even has a hard time getting hold of cell phone records. Again, paying for added layers of protection, such as virtual private networks, defeats the objective of keeping costs low. So stray texts, hacked accounts, lost devices may occur from time to time. I don't anticipate it. It will be rare, but signing this document indicates that the risk of such is clearly understood and assumed by you, the participant. So let me close here by underscoring the key components of this video. VQT is not for mental health disorders. Personal health information is not necessary or wanted or protected. And maintaining confidentiality of information will be strictly adhered to within the confines of normal cell and internet transmission. We waive culpability for breaches beyond our control, which would be hacks, viruses, electronic malfunctions, or unintentional user error. Your consent to such is the only way that PVC does not become too exorbitant in cost or too cumbersome to be effective and efficient. If you have any questions about this information, please give me a call and we can speak directly about it.